Carlton, and I will be presenting over the hantavirus in microbiology. What is hantavirus? Hantavirus is a member of the bunion virus family, where it uses wild rodents as their hosts. They are transmitted from rodents to man through urine, saliva, or scat, which may be carried through the air and breathed in. The hantavirus is a relatively new virus and cannot be transmitted person to person. The virus was named as Hantavirus after the name of the river Hantan in South Korea from an infected field mouse following an outbreak in the Korean War. Where is the hantavirus found? The hantavirus is actually found worldwide. There are confirmed cases all over the world. In the United States, you can see on the map that there is a concentrated area in the southwest states. But those that are more susceptible to the hantavirus are those areas that are heavily populated with campers and hikers. Do you know which ones carry the hantavirus? Which rodents? The house mouse is not typically infected with the hantavirus, but the deer mouse and the white-footed deer mouse are heavily populated with the hantavirus. HFRS is one of the syndromes known to be contracted after the hantavirus. Some of the symptoms include fever, chills, head, back, and abdomen pain, nausea, blurred vision, low blood pressure, and acute kidney failure. Some of the treatments would be fluid electrolyte management, maintenance of blood pressure and oxygen levels, possible dialysis, being that they would be in renal failure. IV ribavirin is an antiviral drug that has shown to decrease illness and death associated with HFRS. If used very early in the disease. Ways to diagnose HFRS. There's little test results to be able to prove HFRS, but they can send off a sequence of blood or tissue to be tested. Hantavirus pulmonary syndrome is another syndrome caused by the hantavirus. HPS is a severe, sometimes fatal respiratory disease in humans caused by infection with hantaviruses. Some of the symptoms that the patient would have is fatigue, fever, and muscle aches, usually large muscle groups, like the back, the thighs, and maybe the shoulder. Headaches, dizziness, chills, nausea, and vomiting. And if those symptoms are ignored, they will start to see coughing and shortness of breath. The treatment with that would be the patient would be intubated and usually on a mechanical ventilator, being that they were in respiratory distress. They would be in the ICU to close monitor all of the symptoms, and I'm sure tests are being run and x-rays. And there's actually a 38% fatality rate for this particular syndrome. Some of the ways to diagnose this syndrome would be the actual lung symptoms, a chest x-ray, or they can send cultures to the CDC for them to be able to diagnose this syndrome. Prevention of the hantavirus. Ways that you can prevent being around the hantavirus are to decontaminate surfaces that rodents are around with urine or droppings from those using a 10% bleach solution. Avoid contact with all wild rodents, their droppings, and nesting materials. Examine the outside of buildings and seal any holes or areas that would let rodents get inside. Avoid sleeping near wood piles or garbage areas that may be frequented by rodents. Store foods in rodent-proof containers and promptly discard, bury, or burn all garbage. Hantavirus in brief. This is just a flow chart of how the hantavirus progresses and how it begins. How the virus spreads to humans. The virus is found in rodent feces. Its infected feces becomes airborne. It is inhaled by humans. From there, you have respiratory distress and serious infection that quickly worsens. The symptoms would be, early symptoms would be chills, fever, muscle aches. Later, if those symptoms are not taken care of, there would be dry cough, headache, nausea, vomiting, and shortness of breath. The hantavirus, like I said, is most prevalent in rural areas. Campers and hikers are most likely to catch this virus because tents rest on the ground close to the feces, which would be inhaled. And like I said, this cannot be spread human to human. Thank you for watching.